Hello, today we're going to provide another update on the COVID-19 vaccine, particularly how it relates to those with arthritis and rheumatic conditions. As we always say, this information is based on the knowledge available at the time that we post this, right now, September 2022. Things continue to change, and we will continue to post more information here as well as on our website as information becomes available. So what is the update now? So as we've shared and as we know for some time now, there's two main vaccines, Pfizer and the Moderna products, which are available for many age ranges. There are a number of other vaccines that are available, not as commonly used, particularly for those with arthritis and rheumatic conditions. What's new though is there is now a new product by Moderna, which is a bivalent vaccine. And this is now available as a one-dose regimen, typically spaced at least 5 months from your last dose of whatever COVID-19 vaccine you had or your previous infection. What's important to note though is regardless of when you got your last vaccine, you also need to make sure that you've received your primary series of COVID vaccinations before receiving this new bivalent one. So what is a bivalent vaccine? What does that mean anyway? So the original COVID-19 vaccine is effective against the original coronavirus strain. So what we were dealing with back in early 2020. At that time, when it first came out, and this is early 2021, that original COVID-19 vaccine was very good at preventing infection, and it reduced risk of severe complications for those who did get infection. However, as we've been experiencing more variants of the COVID-19 virus, that has changed, where the original vaccine is not nearly as effective at preventing infection, although certainly is still very important and a powerful tool to prevent severe complications. So still certainly worth getting. However, Moderna has developed a bivalent vaccine, which is now, bi meaning two, effective against two strains of coronavirus. So the bivalent COVID-19 vaccine is still effective against that original strain, but what's being added is a vaccine against a more recent variant. So the BA.1 strain, or what is really the original Omicron variant that we were seeing earlier in 2022, which is much closer to a match of what we're seeing right now. So is this new vaccine effective? So there has been a study done in people on this new vaccine, 814-person study, and it compared the original vaccine with the new bivalent vaccine, and it found the bivalent vaccine had a much better response against the BA.1 strain and an equal response with the original strain. So good results. As I alluded though to, the BA.1 strain currently is not the predominant strain that we're seeing. Right now we're actually on BA.4 or 5. But note that that is still closer than the original vaccine, meaning it's very likely that this new bivalent vaccine is more effective, not necessarily again at preventing COVID, but at preventing severe complications. And for those who have arthritis, for those who have other rheumatic conditions, that is very important. If you have a choice at this stage, likely getting the bivalent vaccine would be your first choice. But if you don't have a choice and it's time to get a vaccine and you're worried about your risk, getting the original one is still better than not proceeding at all and will still help reduce your risk of getting severe complications if you get COVID. So getting vaccinated, regardless of what it is still a good thing to do. Keep in mind, just as a brief review, for those with autoimmune diseases and on our medications, a third dose is recommended as part of an initial primary series, meaning 3 doses for the rheumatology population is equivalent to 2 doses compared to the healthy population. So we strongly recommend 3 doses. At this stage, if that's 2 doses and a bivalent vaccine, that's great. As we said, the vaccines are very effective to reduce the risk of hospitalization and death. There's some efficacy, as we've talked about before, that the vaccines are less effective after 6 months. And maybe this is different in our population, but really emphasizes the need to stay on top of vaccination in our current environment. The other important thing to keep in mind, both with the original, but still with the bivalent vaccine, is we do have to consider the medications that we're on. So folks who may be taking rituximab or who are on higher doses of prednisone, we know the response your body will have to the vaccine is going to be poor, meaning that you really will not see much benefit, still safe, but no benefit of getting the vaccine unless we get the timing just right. So really important to coordinate the timing with your rheumatologist. For a bunch of other medications that folks may be taking, it may blunt the response a little bit, but it depends on your situation whether or not it's important to hold that medication for a short amount of time or not. And that's something to discuss with your rheumatologist. In many cases, it would be perfectly fine to get the vaccine, continue your medications as is. For those who are on TNF blockers, IL-17, IL-6 blockers, for these, there's only a small concern and we could proceed as normal. Aside from the vaccines, again, as a brief review, we have antiviral treatment available for those who get COVID, so a medication called Paxlovid. This, while it's not readily available in the general population, it is available for those with rheumatic diseases and get on treatment. If you contact Alberta Health, and the contact information is on our website, they will assess your eligibility in that moment, but it's important that you start the medication within the first 5 days of contracting COVID. If you're on a JAK kinase inhibitor, this is contraindicated to take Paxlovid. However, we would strongly recommend that all our patients hold a JAK kinase inhibitor, most of their medications, if you get an active COVID-19 infection, meaning that taking Paxlovid would not be a problem because you would stop one to be able to start the other. And finally, PCR testing, while not as readily available right now, you can get a prescription from your rheumatologist, your family doctor, to get PCR testing. If you think you have COVID, a rapid test, while positive likely means that you do have COVID, a negative result really is less reliable. And if you want to be sure, particularly to see if you might be eligible for Paxlovid, getting PCR testing may be a good idea. So lots going on. Bottom line, though, still remains that the available vaccines are effective at reducing the risk of severe COVID-19 infection, including the need for hospitalization, and they are safe for those in rheumatology and on our medications. As we said at the beginning, this information is up to date as of September. Check back here as well as on our website for more information as we continue to post